My first projection is going to be my lateral facial bones projection. I'd want a 10 by 12 lengthwise IR. And I'd want my patient to be in the anterior oblique position with their head lateral. I'd want their MSP to be parallel to the IR and their IPL to be perpendicular. And then I'd want to center to the zygomatic bone. I'd want my central ray to enter midway between the outer canthus on the zygomatic bone and the EAM, so roughly about right there. Oops. And then I'd want my collimation to be a ½ inch beyond the shadow of the tip of the nose, superiorly above the supraorbital margins, and inferiorly to the gonian, and then posteriorly to the EAM. At this point, I would place my marker and expose. For my next projection, I'm going to do the lateral nasal bones. For this projection, it's going to be about the same as my regular facial bones, but I'd have a 10 by 12 crosswise IR, and I'd be doing 2 exposures, one of each side for comparison. I'd want my patient again in the anterior oblique position with their MSP parallel, their head lateral, and their IPL perpendicular. I'd want to center my IR to a ½ inch distal from the nasion. And I'd want my CR to enter perpendicularly to a point a ½ inch distal to the nasion, so about there. I would place my marker. I'd want my collimation to be from the glabella down to 1 inch inferior to the acanthion and a ½ inch beyond the tip of the nose. And I would instruct my patient to stop breathing and take exposure and let them know that they can breathe. For my next projection, I'm going to do the lateral orbits. For this projection, again, I'd want my patient in the anterior oblique position on a 10 by 12 crosswise IR. I'd want the affected eye closest to the IR, and I'd want to center my IR to the outer canthus of that affected eye, so right about there. I'd want my IPL perpendicular, my MSP parallel, and I'd want my central ray to enter through the outer canthus perpendicularly, like this, and then I would collimate down, include my marker, and then I'd instruct the patient to look straight ahead for the exposure, take the exposure, and let them know that they can relax.